Hello, my name is Bimbai. I'm an occupational therapist. My presentation is on effective teaching methods for education for healthcare providers. According to Harrison Bacon in 2019, in the traditional method of instruction, the professor is deemed the expert in content matter, whose responsibility is to passively transfer information to a group of students without verbal interaction or reflective feedback. Traditional methods have been dominant as teaching methods in the USA higher education. However, new paradigm argues that more active process of students learning is more effective. Some strategies that have been proven to be effective in teaching healthcare providers include active learning, innovative strategies, and constructivism. Sharma in 2017 reported that nurses needed to have the required knowledge and skills to care for patients in a highly complex and diverse environment. All healthcare providers, like nurses, need to be competent in providing care. Critical thinking is crucial to provide safe, competent, skillful nursing practice. Active learning can be defined as seeking new information, organizing it in a meaningful way, and having a chance to explain it to others. Active learning is a broad term used to refer to multiple methods of instruction that promote students to be responsible for their own learning. Active learning involves engaging students and educators in collaborative classroom activities and reflection, thereby promoting higher cognitive skills such as application, analysis, synthesis, and students' deeper comprehension of material. Students can direct their own learning. Active learning improves students' attitudes and motivation and increases student confidence, self-efficacy, teamwork, and communication skills. The strategies of active learning support the theory of adult education, which acknowledges learners as self-directed, responsible, and using previous experiences. Older adults are more likely to benefit from an active learning approach. A systematic review by Harris and Bacon in 2019 studied whether active learning is more successful than passive learning at producing cognitive skills in healthcare professional students. The results showed that 72% of active learning techniques effectively achieved improved recall, understanding, and application of course material. More gains were shown cognitively through active learning than through the use of passive learning methods. Some of the most common methods used in the healthcare professions education were group-based, problem-based, team-based, and case-based learning. Khan and others in 2017 reported that when active learning was incorporated into a physics course, understanding increased from 40% to 60% compared to the traditional teaching method. Active learning pedagogy includes student-centered strategies, which include case-based learning and problem-based learning. Case-based learning is associated with real-life situations. Students direct their learning by exploring realistic, complex situations, stated Sharma in 2017 and Thistlethwaite and others in 2012. It promotes the linkage of theory and practice. The group works together to examine a case. The instructor's role is a facilitator. Case-based learning involves solving problems that have no single right answer, promoting decision-making and general applicability. Research by Thistlethwaite and others in 2012 investigated the effectiveness of case-based learning in achieving learning outcomes in health professional training, including for occupational therapy students. Results were inconclusive on the effects on the learning compared to other activities. Problem-based learning is used in conjunction with case-based learning, team-based learning, and simulation techniques. Problem-based learning occurs in small groups of 6 to 8 people. The steps taken in problem-based learning include establishing learning objectives, collecting information, summarizing information, and reflecting. Students identify resources and take the initiative. Problem-based learning promotes critical thinking in health professionals. Sharma in 2017 reported that innovative strategies use constructive thinking, grouping knowledge into original rational ideas. Innovative strategies must be evidence-based, relevant to the students, empower students to think critically, and include ready-to-use creative techniques and activities. Active learning strategies are part of innovative strategies. Other learning strategies include flipped classrooms, game-based learning, and team-based learning, and concept mapping, discussion, and role play. Simulation is a strategy to amplify real situations through guided experiences in an interactive way. Methods include skits, role play, standardized patients, virtual reality, simulations, computer simulations, and video interactions. Harris and Bacon in 2019 reported that game-based learning makes learning interesting. Students receive immediate feedback, and it is a sufficient method for critical thinking and problem solving. Thompson and others in 2011 did a quantitative pre-experimental analysis on learning and retention of neuroscience concepts by 30 occupational therapy students using interactive online games. The results suggested use of these tools may enhance learning of neuroscience. Students felt the strategies were appropriate, beneficial, and easy to use. The interactive games included visual aids and helped students understand the neuroscience concepts. Students review learning materials such as readings, PowerPoints, voice-over-voice lectures, and videos prior to attending a class in a flipped classroom. During instruction, the instructor facilitates student-driven discussions via hands-on activities that promote content application, critical thinking, and complex problem solving. Bacon and Harris stated that in 2019. According to Sivinsky and Makichi in 2013, discussions help students articulate what they have learned. They give students opportunities to formulate their principles, applications, and prompt feedback on their understanding and misunderstandings. Khan and others in 2017 reported that group work is beneficial for online learners. It fosters collaborative learning from varying disciplines and allows the practice of interdisciplinary communication to prepare students for workforce. Collaboration enhances critical thinking and self-reflection. Interaction and communication are important elements for healthcare providers. Promoting critical thinking and problem solving is important for nurses, reported Weizsäck in 2009. The use of conceptual approach and concept making promotes critical thinking. There are multiple definitions of critical thinking. Weizsäck in 2009 stated that, according to the Fachjons-Delphi, critical thinking involves analysis, interpretation, inference, explanation, and self-regulation. A concept map is a tool used to represent meaningful structures that one has as a concept. First is the focus question. Concepts have hierarchical order with general concepts at the top and specific concepts at the bottom. Then cross-links or connection relationships of the knowledge. Ausubel's assimilation theory has 5 learning steps. Step 1, concept formation. Step 2, subsumption, which is integrating perceived information with previously acquired knowledge and synthesis of information. Step 3, progressive differentiation, that is cognitively organizing information from general to specific. Step 4, integrative reconciliation, combining familiar ideas with new ideas. Step 5, consolidation, mastering one lesson prior to the next. According to Skunk in 2020, students learn best when they engage in learning experiences versus passively receiving information. This was also stated by the University at Buffalo in 2020. Constructivism highlights the interaction between an individual and situations in acquiring and refining skills and knowledge. Individuals are active learners and must discover basic principles for themselves. The key elements of constructivism learning approach are reflective nature, collaboration, and relevance of learning to the learner who acts autonomously and is self-directed. This was also stated by Systemans in 2020. Students test hypotheses, integrate concepts, present valid solutions, and receive peer and teacher feedback. Heft and Scuff in 2017 indicated that feedback given to a student needs to be clearly understood by the student. The student needs to be able to compare their performance to the standard goal. Aligning the elements of the course is important for the course. Elements to be aligned with the desired skill and assessment should explicitly assess that skill. Findings of the study by Heft and Scuff in 2017 found that courses utilizing active learning and multiple opportunities for practice and feedback effectively develops students' targeted critical thinking skills and habit of critical investigation. The constructivism approach uses problem-based learning and inquiry-based learning. The facilitator encourages participants to evaluate new information and modify existing knowledge for the novel situation. This was also stated by University at Buffalo in 2020. The facilitator has a dialogue with students, helping students to construct their own knowledge. In conclusion, the use of active learning strategies has been proven to be more successful than passive learning at improving cognitive skills in healthcare professionals' education. The most common methods used in healthcare profession education were group-based, problem-based, team-based, and case-based learning. Innovative strategies, including active learning and creative techniques, are also considered effective teaching methods that empower students to think critically. Critical thinking is a crucial component necessary to ensure competent healthcare providers. The conceptual approach and concept mapping promote critical thinking, which includes analysis, interpretation, inference, explanation, and self-regulation. The constructivism approach promotes learners to be self-directed in constructing knowledge with the support of a teacher acting as the facilitator. Thank you so much for your time. If you have any questions, feel free to ask me. I will open the floor for questions. Thank you. And here are my references.